everyone. My name is Angela Landon, and I am a Medicare insurance broker. I am located in California and licensed in multiple states. And today, what I'd like to do is go over Medicare Parts A and B. I'm not going to spend too much time on Advantage plans or Medigap plans. I'd like to review that in detail in later videos. For this video, I'd really like to concentrate on Medicare Part A and Medicare Part B. So just to get started, who's eligible for Medicare? So a person becomes eligible for Medicare once they turn 65 typically. However, there are some people under 65 who are on Medicare. They have become eligible after being on disability for 24 months, and then they become eligible for Medicare. Additionally, somebody who has end-stage renal disease would be eligible for Medicare, and then somebody with ALS would also be eligible for Medicare at any age. Now, in addition, you do have to be a U.S. citizen or you have to be a resident for 5 consecutive years. Now, how do you apply for Medicare once you turn 65 or once you're eligible? So there's a few ways to do that. Now, you can apply for Social Security as early as 62. So if you have already enrolled and are receiving Social Security, they're going to automatically enroll you in Medicare once you turn 65. And actually, they're going to send you your Medicare cards about 3 months prior to your birthday. So you definitely want to keep an eye out for that in your mailbox. I know multiple clients who have not noticed that and have put that aside. Luckily, some of them realize that they put it aside. Others have discarded it altogether. So know that that will be coming in the mail if you are already receiving Social Security. Now, if you're not receiving Social Security, you would have to take some action if you're ready to enroll in Medicare. So what you would need to do is you can either call Social Security, and I do have the number listed here. It's 800-772-1213, or you can go online at ssa.gov. If you are comfortable with a computer, applying online is pretty straightforward. It doesn't take too long. To me, the hardest part that clients have faced with doing the process online is logging in. But if you have a login for your government account to see what your Social Security is, it's the same login. And so you can log in from there, click on Medicare, the Medicare tab, and then enroll in Medicare from there. If you don't want to do that, you can't just walk into a Social Security office. If you do walk into a Social Security office, they will make an appointment for you. So you can walk in to make that appointment, or you can call to make an appointment. And you can do it over the phone, the appointment, or you can do it in person. It just depends on your comfort level and your individual needs. So what is Medicare? Original Medicare. This causes lots of confusion for people, so I really want to focus on what original Medicare is. So when it comes to original Medicare, that includes Part A and Part B. When you enroll in Medicare, that's what you're enrolling in, Medicare Part A and Part B. So Medicare Part A is your hospital coverage, and Medicare Part B is your medical coverage. There are optional coverages, and I will go over that in later videos, so I'm not going to touch on it too much now, but optional coverages do include Medigap coverage, also known as a supplement plan, Part D prescription coverage. So your prescription coverage is an optional extra coverage, and also another option would be an Advantage plan, so that's considered Part C. Those are optional coverages. So when it comes to original Medicare, you're talking about A and B. So when it comes to Part A, hospital coverage includes whenever you're hospitalized. It includes includes things like skilled nursing facilities. It also includes hospice care. Really, anytime that you're overnight and you need overnight care, that's billed under hospital coverage. Now, hospital coverage, so Medicare Part A, as long as you've paid into the system for 40 quarters, which equates to 10 years, and this is in your lifetime, it does not have to be consecutive. So if you'd paid into Medicare and Social Security for 10 years, your Part A is going to be premium free, meaning you don't have a monthly cost for Part A. That's going to come out of what you've been paying into all this time. Now, if you haven't quite made the 40 quarters, the cost does go up from there. Just a disclaimer, these are the numbers for 2025, and everything does rise a little bit every year. So if you're viewing this outside of 2025, the costs are not going to be exactly the same as what you see here. The other thing to keep in mind is that if you haven't quite made the 40 quarters, but your spouse has. So if you're married and your spouse has worked 10 years and paid into Social Security, you could have the option to get your Medicare under your spouse's coverage. Now, this is something that you would have to talk to Social Security about. It's easier to do that by calling them or making an in-person appointment, either way, but they don't have an online option to select under spouse's coverage. So you would have to do that by calling and making an appointment or going down there and making an appointment. Now, Medicare Part B is your medical coverage. So that's things like when you go to see your primary care doctor, that's covered under medical insurance. So that would be your primary care doctor. It would be any kind of specialist. It also includes any kind of procedures. So if you go into the doctor and have any kind of outpatient procedure, so you go and get, it could be a simple surgery, it could be, some kind of procedure for the day, where you go into the office and you leave that day, that's going to be billed under Medicare Part B. That also includes emergency care, and it also includes durable medical equipment. And so that would be, for example, if you needed an oxygen tank or some kind of physical equipment, that's under Part B. And this is not a complete list. There's other things. For example, there are also doctor-administered drugs. Those are billed under Part B as well. So there are some medications, if the doctor has to do an infusion or has to do something where they're doing the treatment, that's typically covered under Part B as well. Now, for Part B, there is a cost to that. And again, these are for 2025. So when it comes to Part B, first of all, there is a $257 deductible. So that's before any coverage happens. You'd have to pay that deductible, and then Medicare would kick in and cover about 80%. Well, they cover 80%. The standard cost for Part B is $185 in 2025. There is something called an income-related monthly adjustment amount. So that means depending on how much you made 2 years ago, they have a look-back period of 2 years. That's how much they have a chart, and I'll show you the chart. They have a chart that they charge you based on what you make. So based on your income, your cost for Part B could go up depending on what bracket you fall into. So for $185, as long as you as an individual make $106,000 or less, or as a married couple, $212,000 or less, then you're going to be charged $185 per month. But if your income exceeds that or exceeded that in 2 years prior, then they're going to charge you a higher amount. Okay, so I'd like to show you the income related monthly adjustment amount. So this is the chart that shows depending on how much you made, and once again, it is a 2-year look back period. So based on how much you've made, this is the amount they're going to charge you for Part B. And also notice there's an additional cost for Part D. So Part D is prescription drug coverage. Prescription drug coverage is not automatic. So prescription drug coverage is something that you can either get separately, so you can enroll in a separate Part D plan so that you have original Medicare and Part D, or it can be included in an Advantage plan where it's all inclusive A, B, and D, and that's considered Part C. So that's an Advantage plan. How much you make and how much you made 2 years ago, they would charge you a certain cost for Part B, and then whatever your premium is for Part D, you can see there could be a little bit added to that. So in some cases, I'm just giving you an example, somebody might have an Advantage plan where they don't actually have a premium cost every month for that Advantage plan, yet they still see a little bit extra taken out of their Social Security every month. It's possible that they are in the IRMA bracket, a later IRMA or a higher IRMA bracket. And so then they could be getting that amount taken out every month for Part D, even though there's no premium. It's just a little bit extra that's coming out. So this is the chart for income-related monthly adjustment amount. Based on your income, how much you're going to pay for Medicare Part B and how much extra you would be paying for Part D. Part D is the prescription coverage. Okay, one thing I want to show you is when it comes to cost for original Medicare and it comes to hospital coverage. So when it comes to hospital coverage, yes, your monthly premium, if you've worked and paid into the system for 10 years, you don't have a monthly premium. However, if you do get hospitalized, right off the top, there's going to be a $1,676 deductible per hospital stay every 60 days. So if you were hospitalized and then 3 or 4 months later you end up getting hospitalized again, there is another $1,676 deductible. Now, if you end up having to stay in the hospital for a long time, so after you pay the deductible, you then have a $0 copayment and you can stay in the hospital up to 60 days. But after the 60 days are up, from day 61 to 90, there is a $419 per day cost when you're hospitalized on day 61 to day 90. So that could end up being an additional $14,246 if you happen to be hospitalized for 90 days. Now, if you happen to need skilled nursing care, so a skilled nursing facility is typically where somebody might go after they've been hospitalized and they're not quite well enough to go home, or they need just a little bit extra care, maybe more physical therapy, or more they need to be, stay off their feet, or whatever the case may be. If you're in a skilled nursing facility for 20 days, there's no cost for that. Once you get to day 21, there's a $209.50 cost per day for days 21 to 100. So if you happen to be in a skilled nursing facility for 100 days, that's an extra cost of $16,760. And so that's just if you need it. These are per day, so it's whatever you need. But what I want to make sure that you know is that when it comes to original Medicare, there are additional costs that even though you've paid into the system, there are still copays, coinsurances, and deductibles that you would be responsible for. And so that's where things like a Medigap plan or an Advantage plan would come in handy. And I'll go through that a little bit more in a later video. One thing to keep in mind is there is a late enrollment penalty. I want you to be aware of this, but I want you to know it's not super scary because there are certain circumstances where this would not apply to you. So there potentially could be a late enrollment penalty if you do not enroll in Medicare during the time that you're able to enroll. So typically, once you turn 65, you can enroll in Medicare 3 months prior to your birthday month, and 3 months after your birthday. Now, if you are not working and say you were on Covered California, or maybe you didn't even have any insurance, then if you didn't have any insurance at that time, you're going to need to enroll in Medicare within that time slot, or you would be subject to a penalty. And the penalty is 10% per 12 months where you didn't enroll in Medicare when you were eligible to enroll. Now, do keep in mind there are special situations where this wouldn't apply. For example, if you are working and you have insurance through your employer, or if you have insurance through your spouse, then you would probably not be subject to this penalty as long as that insurance coverage is considered creditable by Medicare. So when it comes to original Medicare covers 80% of your medical cost. So this is both A and B. For your hospital and medical expenses. Now, original Medicare is not going to cover your deductibles or your copays. They're not going to cover your outpatient prescription drug coverage. They don't cover healthcare outside the United States. It also doesn't cover things like hearing aids. It doesn't cover vision or dental. So original Medicare is for your hospital and medical coverage, and they're going to cover you at 80%. So that leaves you with a 20% responsibility. But I wanted to make sure that you understand what Medicare A is and what Medicare B is, and also what the potential costs could be. And when it comes to your medical treatment, you're subject to 20% of the cost of whatever that procedure is with your medical procedure. And there's no cap. So it's not that they're going to charge you a certain amount and stop it at any point. When it comes to original Medicare, there's no cap to the amount of money that you can pay. So depending on your health or what happens, the kind of health care that you need, you could potentially have quite an extensive cost that you maybe didn't expect. So please know that these are the costs when it comes to original Medicare A and B. So I hope that helped. Please, if you like my video, like and subscribe, and I will see you in the next one.